Depisteo is pleased to show you how to perform a visual screening test using VT1. Operation of the device may be done by computer using the software or by using the remote control. VT1 allows you to detect most common visual problems in only a few minutes. It may only be used by staff members who have been trained in its use. Let's begin with the device. VT1 is ergonomic. It adjusts to adapt to the patient, and not the other way around. It is easy to transport thanks to the trolley we also provide. It is important to ensure the patient is positioned properly prior to starting an examination. This will guarantee a successful examination. We recommend conducting the examination with the patient in a seated position, back straight, facing the device, and adjusting the device so that it rests on the patient's forehead. In fact, VT1 features a frontal sensor that engages the device's backlighting. If it is not properly positioned, VT1 will not light up. The device has two sets of lenses. The upper lenses allow testing of distant and intermediate vision. The lower lenses allow testing of near vision. The lighting system for performing tests is assured by LEDs, which offer two advantages: unlimited use duration and no test yellowing. We will present all of the available tests. Prior to performing a test, don't forget to consult the list of medical contraindications listed in the manual. First, the ability to perform distant, intermediate, and near visual acuity tests. These tests may be performed monocularly or binocularly. VT1 offers two optotype choices: letters and Landolt rings. The binocular acuity boards, right eye and left eye, are all different, but it is recommended that you alternate between optotypes for each change in distance. There are other VT1 models with a choice of optotypes, distances, and various tests. When opening the window, you will find instructions at the top you'll give to the employee, and on the bottom, instructions for the operator. These acuity tests may be conducted with or without correction. You can check low phototopic to reduce light intensity for photosensitive employees. The Failed button allows you to indicate lack of test comprehension on the part of the patient. The hypermetropia test is conducted in the same way as the one previously shown. Please note, to properly understand this test, this is an inverted test in the sense that the device adds a diopter in order to detect hypermetropia. If the employee sees clearly, he has a tendency toward hypermetropia. If the employee does not see clearly, he is not hypermetropic. The mesopic test is an acuity test in twilight vision, meaning much lower levels of light intensity. It is most often used for drivers, among others. Contrast tests enable you to measure an employee's sensitivity to contrasts by indicating the last character perceived as the least dark. Once the response is validated, the software indicates the level of contrast perceived. The astigmatism test is only performed monocularly. The employee should state if all the lines are identical or if some appear darker to him. Depth perception tests. To perform this test, the employee should indicate for each box which shape is distinct from the others. The test includes 6 levels of increasing difficulty. Reliefs are measured in arcs per second. Fourier test allows you to detect a parallelism defect of the visual axis. The employee indicates in which zone he perceives the white point. Fusion test allows you to monitor binocular vision. The employee indicates how many points he perceives. If the two eyes fuse normally, the two images are placed on top of one another and the employee perceives 4 points. Color test. The employee has to read the numbers in the tabs. Depending on the numbers not perceived, this test allows you to detect the type of chromatic deficiency that appears. Glare sensitivity test allows you to detect problems related to light sensitivity. The employee should indicate, if possible, which information he is capable of reading, starting with those that are closest to the light source. Brightness level corresponds to the glare coming from a car backing up. Amsler grid test allows you to detect AMD, glaucoma, scotoma, among other conditions. The employee indicates both whether he clearly sees the central point and whether the grid is sharp. Because AMD is an irreversible pathology, it is recommended that this test be performed starting at the age of 40. Central glare test allows you to calculate vision recovery time following glare. The test begins with an acuity test in which the employee should read the smallest line he is capable of reciting without strain, following glare lasting 10 seconds. A new acuity board appears, and the employee has to reread the same line as before. A stopwatch will allow you to evaluate his recovery time to normal view. Visual field test. VT1 allows you to perform the complete visual field test using an integrated and motorized glasses in the mask. There are 3 ways to perform this test: central visual field, external visual field, peripheral, complete visual field. The test consists of monitoring the employee's visual field. He should indicate to the operator each light source perceived. The operator may perform the test in 2 ways, either through use of a predefined sequence or by directly selecting the points the operator wishes to test. Please note, lens branches may conceal a certain number of points in the visual field. VT1 is a customizable, highly configurable device. Configuration is accessed by the Option tab, then select Parameters. To begin, configure your software according to your exam needs. This operation is only to be performed at first use. The Parameters tab allows you to adjust various base data. Test Display allows you to configure the screen background. The operator may decide to display all the device's tests, or only the tests for the chosen sequence, or to customize the screen background by checking or unchecking only the desired tests. Print allows you to customize the print report by deciding to display all tests or only tests actually performed. You also have the option to print in color or black and white, including your logo by inserting it at a dedicated spot, or checking or not checking the bitmap format. Lastly, More lets you add or remove fields in the heading of the printing report. First slide. First slide, allowing you to confirm that the employee is positioned properly. You have the option to deactivate it. Database. The placement of the database may be adjusted. Please consult your IT department. Additional fields. This function allows you to add fields in the employee identification section. BPS speed. Maintain the default configuration because the 38400 BPS only pertain to earlier Depisteo devices. Lastly, you have the option to select the software language, date format, distances format, and acuity format. Sequences tab. Here you create your sequences according to the professional profile. Click on New, name your sequence, and add all the tests you wish to implement in your protocol. For each slide added, make sure to correctly select the modalities, meaning that the test will be performed binocularly, either right eye or left eye, brightness, and also optical mode. Please note, the order in which you add the examination will be the order in which your protocol will take place. The Go Up, Go Down, or Remove buttons allow you to change the order of the tests or to delete them. Any sequence may be changed, renamed, or deleted. For each sequence, you have the option to add an active scoring. Scoring allows you to set the minimum and maximum limits on one or more defined tests. You can edit, create, or delete a scoring. To create one, start by naming it. And indicating the minimum values required to validate each test. It is imperative that these limits be validated by the doctor. Then you'll see your newly created scoring. Instructions tab. Each examination window has two instruction fields, including one for the patient and one for the operator. Export tab. Export mode exists in several formats, including PDF and GDT, and allows you to create the file readable by software other than VT1. GDT export is mainly destined for Germany. You also have the possibility to export in CSV format. To configure the export, click on More, the file name. Select Always in the Automatic Backup section. Indicate the path of the file created in the Backup Index tab. Select Fields in the File Name section. You have the option of configuring the order of patient file search. Click on OK. User tab. Not mandatory. Use this window to enter your contact information and show it at the top of report pages. As a reminder, any parameter is validated with the Apply button. To perform an examination, when you open your VT1 software, you will find rapid access icons. If you have an interface with a professional software program, the employee identification phase will already be implemented, so you'll only need to launch the examination automatically or manually. Without an interface, click on the New icon. Fill in the mandatory fields corresponding to fields in red: surname, given name, birth date, username, sex, whether or not the individual wears corrective lenses. Other identification parameters may be filled in as an option: the company, employee position, type of correction. Please note, for those who wear corrective lenses, the software program will automatically pre-check the Test with Correction zone. If the patient has forgotten his glasses, remember to uncheck this box. Once the identification is completed, validate with the OK button. The examination will begin. You can perform an examination by using pre-programmed sequences or perform the examination manually. To use the configured sequences, choose the sequence desired in the list of sequences from the toolbar and click on S to start. Read the instructions to the employee, then click the response given according to the operator instructions. Proceed with the whole protocol. At any time during the examination, you can go back and attest. To perform an examination in manual mode, select the test you want to perform according to the various command buttons. As soon as a command button is clicked, the device moves to the corresponding test and the window for this examination appears. This window allows you to enter the employee's responses. This manual mode allows you to add tests that would not be included in an initial sequence. At the end of the examination, prior to saving and/or printing the report, you have the option to add information shared by the employee during the examination which was not entered during identification. To do so, click on the taskbar on Exam and enter the information in Comment at the very bottom. Lastly, for two important reasons, you should be sure to save your exam using the Save icon. If you are interfaced, it is through this saved file that the examination will be archived in the professional software program. Without interface, it will allow you to increment the Depisteo database and therefore be able to locate previous examinations and employees. For versions with remote control, you have the option to order an LCD remote control in order to operate the device without the VT1 software program. At this point, the answers are retranscribed in writing. To do this, scroll through the tests you wish to perform and manually write out the patient's response. A menu will allow you to select tests. The Open icon allows you to search for an existing examination. The Identification icon allows you to change or integrate additional information to an already completed identification with New. The Always On icon allows you to remove backlighting from the frontal contact and leave VT1 on permanently. Lastly, the About icon provides you with the software version. In Help and System Information, you can access all the data and your device configuration. In Open the Sequences folder, you can access all of your programmed sequences. You can copy this file and paste it to another post to save time and avoid reprogramming your sequences. There are two types of examination report printing. If you print directly using the software, select File, then Print Preview, and then Print. If export is automatic, an examination report in PDF format will be automatically saved at the location indicated in the configuration settings. To ensure hygiene between each examination, you must disinfect all parts that come into direct contact with the skin with antibacterial wipes and Bactinol-type fungicidals. Please contact the manufacturer for the list of wipes and/or ingredients that are compatible with VT1. Nevertheless, we recommend use of our microfiber included with the VT1 to regularly clean the external surface of the lenses. Depisteo recommends annual maintenance of the VT1. In the U.S., only Depisteo is authorized to provide this service. Internationally, only an authorized service provider may provide this service. Prior to any use, please read the user manual you will find in the Help section, particularly for contraindications and safety regulations. If the device malfunctions, do not attempt to open it. Contact after-sales service at Depisteo or a company approved by Depisteo to provide maintenance. Lastly, for additional questions, contact your sales representative.